Welcome to my second part on my lecture on postnatal growth and development. We now go to developmental milestones. Now these milestones are seen in every child at every age of month. Now these milestones develop in a cephalocaudal manner, meaning to say that development starts from the head and ends on the lower extremity. At the first month of age, a child or an infant is only able to regard, and then at second month able to smile, third month turns head. Take note that the third month the child is only able to turn his head primarily because this is only the time when the cervical spinal starts to develop. At fourth month he is able to hold his head or has control over his head. Fifth month the child is able to roll over, transfers object by the 6th month of age, sits briefly at 7 months, able to creep at 8 months, pulls up at 9 months, 10 months is able to cruise around the bed, walks with support by 11 months, and at 12 month or 1 year old the child is able to stand alone. Now this picture will show you the different milestones at different age groups. Now we go to the domains of development. There are 4 domains of development: the motor domain, language domain, cognitive domain, and the personal or psychosocial domain. Under the motor domain, we have the gross and fine motor movements. Now gross motor refers to the posturing of the head, the trunk and extremities, or the large group of muscles, whereas the fine motor involves a well-coordinated movements of the small groups of muscles. Now factors which may influence motor ability are the following: environment, physical condition, health condition, and mental status. This slide will show you the different gross motor abilities of the different age groups of these infants. At birth, gross motor movements involve the jerky movements of the upper and lower extremities. Whereas by the 3rd to the 5th month, you would see here that the child is able to sit briefly. By age 7 to 9 months, the child is able to sit by himself. And at 1 year old, the child is able to stand by herself. We now go to the fine motor skills of these different infants. At birth, you wouldn't see any fine motor skill that is being elicited by the infant. By age 3 months, a child is able to grasp objects from anybody. At age 6 months, the child is able to clap his hands, and by 9 months, that is from 6 to 9 months, and by 1 year old, the child is able to grab objects and throw these objects away from him. The next domain of development in language. Language is the art of communication, or the ability to understand another person and to be able to make oneself understood. Language has progressive stages. You have the reflex sounds, the babbling, the gesture, and finally the word usage. For language domain, there are 2 types of languages. One is receptive and the other one expressive language. At different age groups, you have also different developments of these specific languages. For infants 0 to 3 months, receptive language only refers to the alertness to the sound being produced in the environment, whereas expressive language would include your crying, social smiling, and the cooing. For the 4 to the 6 months of life, one responds to the voice and name calling, whereas for expressive language, the child is able to laugh out loud, clicks tongue, and begins babbling. For 7 to 9 months, the child turns his head towards the location of the sound, whereas for expressive, he is able to babble mama and dada indiscriminately. For 10 to 12 months old infants, receptive language would include playing peekaboo, understands the word no, follows one-step command with gesture. And expressive language would include saying the words mama and dada appropriately, able to wave bye-bye, begins to gesture and shakes his head for no. Now, here are some simple mnemonics that will help you understand the development of language domain. The expected number of words in a sentence a child can say is equal to his or her age. For example, a 2-year-old child should be able to say 2-word sentences, whereas a 3-year-old child 3-word sentences. Other mnemonics would include the following. By age 1, the child is able to use single words, or 25% of words are intelligible. At age 2, 2-word sentences, 50% of those are understood. By age 3, 3-word sentences, 75% understood. Whereas at age 4, 4-word sentences are fully understood. The third domain of development is your cognitive or your adaptive domain. This is the most significant as this is related to intelligence. It is the ability of one infant to utilize and manipulate objects, and it uses both motor and sensory coordination. Likewise, the child is able to use his or her past experience to be able to develop this domain of development. As you would see in this table, you would note the different cognitive development at different age groups. So here are some examples of the cognitive domains of development. A 15-month-old infant should be able to feed himself or herself with spoon. An 18-month-old child should be able to have daytime control of toilet habits. A 2-year-old infant refers to self by name. A 36-month-old child is able to feed his or herself well, while a 4-year-old child is able to brush his teeth. The last domains of the development is your personal and social behavior. Now, this domain is primarily influenced by culture, which includes habits and attitudes, and the ability of the child to get along with other people. Personal and psychosocial domain primarily involves emotional development. During the first 6 months of life, one or two of the more expected psychosocial domains will be your smiling and laughing in response to people and unexpected sights and sounds. By 6 to 8 months, you would note that these infants would already have stranger anxiety triggered by the ability to discriminate between familiar and unfamiliar faces. Likewise, your personal psychosocial domain will involve intoxication of their new identities with regards to their new abilities. They explore while orbiting around parents. At 18 months of age, they are able to increase clinginess to their parents or to their guardians, and the usage of the word no to declare independence. Now we will go to the summary of the different domains. I will show you the table at different age groups as to what development an infant goes through in these different domains. For newborn, we'll take note of the gross motor development, which involves the startle reflex or the Moro reflex. Language is expressed through crying, as the may indicate hunger or uncomfortable. At 2 months of age, you will note here that the child is able to smile and able to vocalize, as said earlier during your developmental milestones. At 4 months of age, the patient is able to roll over and likewise able to localize the sound. At 6 months of age, the child is able to chew. Likewise, this is the ideal time to introduce your complementary feedings. At 8 months, the child bounces, transfers object from one hand to the other, and already able to play the peekaboo. At 12 months or 1 year old, the child is able to stand alone. He likewise throws toys anywhere, able to obey commands or requests, and attempts to use the spoon for eating. At 15 months, the child should be able to walk by himself, imitates a vertical stroke, and produces 10 words. At 1.5 years old, the child creeps upstairs, indicates his or her needs by indicating what he wants, uses the spoon. At 24 months or 2 years old, the child is able to run well, and likewise should be toilet trained by day. At 2.5 years old, the child is able to jump, imitates a circle, and likewise helps in simple house tasks. At 3.5 years old, the child is able to stand on one foot, gives his full name, and identifies his sex. In summary, I have presented to you my lecture on postnatal growth and development. For growth, take note of the different computations for weight, length, head circumference, and chest circumference at different age groups. Likewise, normal values for each age group was presented. I have also discussed with you the different domains of development and have shown you a table of the domains at different age groups. Thank you.